just in time for Father's Day. This is Men's Health Week, and joining us to talk about some wellness tips for the men in your life, Dr. Kenneth Hudspeth of the Heart Hospital of Austin's Executive Wellness Program. Good morning. Thanks for being with us.
Thank you, John.
So the CDC has, guidelines for men's health. It's kind of the normal things you'd expect: quitting smoking, exercising, eating healthy, cutting back on stress, getting regular checkups. Of those things, in your opinion, what is the most important for guys, or the most effective for men to do?
Well, they're all important, and you've kind of stolen my thunder there. But certainly establishing a relationship with a primary care physician or physician assistant or medical personnel of some kind, it's really important to keep yourself in good health, and we try to assist in that. At the Executive Wellness Program at the Heart Hospital, we go through a thorough one-day complete physical. You don't always need that. Some of you younger guys can probably get by with that about every third year, but as you continue to accumulate birthdays, it's good to go in and get that regular checkup. And as we do get older, it's particularly important to check on the prostate, be sure that those numbers are good.
When does that become? When should a guy start thinking about that?
Well, the recommendations are really ramped up at about 50 years of age. In my clinical experience out in Wimberley, I did find some guys in their 40s that were experiencing an elevated PSA, or prostate-specific antigen. It turns out that those tumors are more aggressive kind of tumors. The recommendation is to start the testing and the exams at 50. I tended to do that a little earlier. Yeah. I always discussed it with my patients. And you have to be really careful with that PSA. We really want to be sure that we're not doing too much examination. The U.S. Preventive Health Organization tells us that there was too much, too aggressive treatment or biopsies and that sort of thing going on.
Unneeded sort of medical procedures and things like that.
And what you're looking for is a delta. You're looking for change. You're looking for a bump in that PSA. And I would say that is probably the one issue that men have unique to the ladies.
Something to keep an eye on. Now, quickly, before we run out of time here, we're a little bit short now. Do you find that it's harder to get men to go to the doctor and get checked out?
Yes, we're kind of bulletproof, we think. And I was that way until I started checking those blood numbers, and here we go, the cholesterol thing. And so you have to be very aggressive about some of those numbers.
So bottom line,
checking the blood sugar, checking the cholesterol, checking the particularly keeping the blood pressure under control for stroke prevention.
So, get out there, get checked out. Dr. Ken Hudspeth, thank you very much. We appreciate it.